right, welcome to the Elevate Compliance podcast. My name is Will Gilmore. I appreciate you being here with us today. Elevate Compliance is an all-in-one compliance platform for dentistry that basically takes all of the confusion and all of the difficulty surrounding compliance and makes it easier for you in the practice. We have these amazing manuals that we've put together. We have an online platform that's accessible from any device where you can download all the forms that you need. You can access your trainings whenever you need them. And so we'll get into talking a little bit more about that today on the show. Also, we have a guest with us here on our inaugural episode of the podcast. That's Amie Granger. She is a hygienist out of Battleground, Washington, but she also just started her own company called POM Medical. And POM produces first aid emergency medication kits for dental practices, and they're really incredible. It's totally a different sort of system than what you may have seen before from emergency medication kits, especially because she takes care of auto replenish for you. It's got these really neat cards in there that literally walk you through how to use particular medications. Of course, you need to be trained on how to use them, but it gives you some peace of mind, hence her name, POM, peace of mind, of her company. Gives you the peace of mind of knowing that you have all the emergency medications that you need anytime that you need them. So we'll get into talking to Amie here in just a few minutes, but just to give everybody a little bit of an idea about what we're going to cover in these podcasts and what we're going to talk about, compliance is something that in the dental industry is so, it doesn't ring well in people's ears, right? You hear compliance and immediately you think of OSHA, you think of HIPAA, infection control maybe comes into mind. And the reality is that a lot of practices, a lot of dentists just don't really want to do it. Or if they do want to do it, it's because maybe they're avoiding getting in trouble. Maybe you had an employee that you let go who you're worried about filing a complaint. Maybe you on your radar, other practices in your area have been investigated randomly by OSHA and you're concerned that maybe that's going to happen to you. But no matter what, all of those things have a generally negative connotation associated with them. And most practitioners don't really want to think about compliance, but compliance can be fun. It can be fun, it can be interesting, and the reality is it can save you a lot of money and a lot of time and a lot of headache if you just put a little bit of attention and time into it. So we'll talk a little bit about, OSHA, HIPAA compliance, and what the Elevate platform can offer to you and your practice. The main thing that I want to do by this podcast is to have fun. And that's really kind of my goal, is to be able to have some interesting people from the dental world around the country to be participating in the podcast. Again, we're interviewing Amie today. I've got Kirk Teachout from the 7-Figure Dentist Program. He's going to be joining us on the next episode. We'll have Dr. Aditi Agarwal coming on the show in a few weeks. So it's going to be great. We're going to have some really interesting people that we're going to be interviewing, and it's just designed to have fun. The idea behind this podcast is to just goof around a little bit. Yes, we're going to talk some compliance. Yes, we're going to get into that a little bit. But I'm a big foodie. I'm a gamer. I've been, building my own computers for a long time in my life. So I got a lot of interesting things that I like to talk about other than compliance. We just kind of center the podcast around that. So without further ado, let's go ahead and bring Amie onto the podcast and talk a little bit about POM Medical. All right. Well, welcome Amie Granger to the podcast. Thank you so much for being here with us today. Amie is a dental hygienist in Battleground, Washington. If you don't know where Battleground, Washington is, it's just northeast of Vancouver, down in the southwestern corner of the state. Out of curiosity, do you ever just tell people you're from Seattle when you're traveling or anything when people ask where you're from?
It's funny. I say I'm from near Vancouver, Washington, not Vancouver, BC, and Washington, not Washington, DC. So yeah, it's kind of a roundabout way of introducing where I'm from. But yeah.
And I grew up in Northern California, just outside of Sacramento. But when I lived in Tennessee, that's what I would tell people all the time. Yeah, I'm from the Bay Area, because it was easier than trying to explain, all of that. So
exactly.
Well, thank you so much for being here with us today. So obviously you're a dental hygienist. I mentioned that just a moment ago when I did your little introduction, but I understand you have a new venture that you're working on that you're excited to talk about. So I'll kind of hand the floor. I'd love to hear more about what you're doing with POM.
Yeah. So POM is a dental medical emergency kit company where we supply a dental medical emergency kit to dental offices, and has stocked all the medications that are necessary for dental medical emergencies. We refill them. We have handy dandy little cue cards in the kits that help us guide us through dental medical emergencies. So it's a kind of a full package, if you will, of dental medical emergency kit. There's a lot of dental medical emergency kits out there, so I do realize I have competition in my field, but none of them are built by dental professionals. So
Yeah. Well, that's
I feel like
awesome.
that,
So
yeah,
tell us a little bit more about the little cue cards. So like you're talking like for different types of emergencies, just like quick
yeah,
little.
absolutely. So this is the kit. This is
Okay,
an
yeah,
example
right
of the
on.
kit. And you can open it up and it has all the medications in there. So this is an example of a kit that has the drop epinephrine in it. And you just grab out, say you need an epinephrine, you grab out, it tells you exactly how to use it. All the vials in here, the needles, the syringe, the band-aids, alcohol wipe, everything's all in packaged in here. And the cue card will walk you through common medical emergencies, adult dosing, child dosing, and how to use it. So these cards are always going to be updated when if there's any new regulations that come out or new recommendations on how to use them. I'm in close contact with the dental pharmacologist Mark Donaldson,
Okay.
and also a couple oral surgeons, John Alonge and Stan and Steve Beednell. So Dr. Steve
Awesome.
Beednell. So yeah, so they're all kind of helping me kind of create this kit to make it effective and useful for dental professionals across the states,
Yeah.
hopefully. Yeah.
Yeah, that's awesome. Well, so I'm sure you're familiar in Washington, they just changed the rules about what are required for, emergency drills and those types of things. So yeah, that's fantastic.
Yeah.
And again, to do my own little plug here for compliance, for anybody out there listening, getting one of these POM kits is a great opportunity. Open it up and use that as your monthly safety meeting. Get to know it a little bit, check the stuff out, because yeah, it definitely does not look like some of the kits that I've seen out there, which are just kind of here's your meds, don't ask questions. This is great.
Yeah.
So
Exactly.
what does the auto replenish typically look like? Is it annual? Is it based on like the expiration of the medications only, or what?
It's based only off the expirations of the medication.
Okay.
So we're not going to be charging like an annual subscription fee or some high monthly cost for the medications. We'll only supply them when they expire. Also, if you use a medication before they expire, there's a handy dandy cue card on here. So you just scan that with your phone, send me a message, and I'll get you shipped out a new medication. So it's just my whole goal is to make this as stress free as possible because medical
Awesome.
emergencies are stressful. And um,
Yeah.
yeah, so we're trying to just mitigate that. So
Yeah, that is awesome. So, with all of this in mind and what you're doing with these great kits, what inspired this? What kind of brought about your passion for wanting to put these together?
yeah, so I've been managing our medical kits at my dental office, which it sounds, not like a necessarily full-time job, but beside doing hygiene, I've been doing OSHA compliance for our office and managing these kits. And it was so frustrating. I was always like, okay, doctor, I need you to order this med. I need you to, and then we're like, oh, let's try to find the best deal on this med or that med. And then the kits were just messy and hard to use. And then when I actually needed to use it was very stressful. I was like, I have all the training. I know I've taken all these courses. I know how to use this, but why did my brain just go offline right when I need it the most? And so I was like, there's got to be a better way. So talking to the
Awesome.
oral surgeons and pharmacologists, they were like, do it. So they've
Yeah.
been helping me get it going.
That's really cool. Yeah. And so for the last 10 years before I started Elevate Compliance, the company that I was
Yeah.
with formerly, I also did CPR training for those 10 years.
Oh,
And
cool.
so I totally understand what you mean. I would be in a class and everybody would really be tuned in and they're getting it and they've got the mannequins and we're talking about where's your meds and all that. And we would do a practice drill. And when the practice drill would happen and I would pretend to be the patient, maybe go in the dental chair, pretend like I was having an emergency, like you said, everyone's brains would kind of scramble. And
Hmm.
that's what fight or flight does, right? It sometimes
Absolutely.
blanks you out. Sometimes people get hyper focused and they know what they need to do. But having a
Yep.
kit like this that can really make it a lot easier, I think that's absolutely huge. And
Yeah.
so have you had in a practice that you've worked in before, have you had a dental patient emergency and what happened? How was the outcome?
Yeah. So there actually has been a few, unfortunately.
Yeah.
Uh, and I work in a very busy dental practice, and not all of these were my patients. I did have one. Thankfully, it worked out really well. And um, it was a patient came in. She normally comes in early in the morning because she does have diabetes. And I took vital signs on her. She seemed a little off. And I did know this patient because I see her every 6 months.
Sure.
And she seemed off and a little agitated, little rude, respectfully, if you will. And she is not a rude person. So I was like, something seems off. And I was like,
Weird.
are you feeling okay today? And she kind of was like, yeah, I'm fine. I'm fine. I'm fine. So, and I was like, haven't we eaten today? And anyway, all of a sudden she kind of started getting a little bit almost like, you know, I could tell she was kind of out of it.
Hmm.
And so I grabbed our kit. I didn't have this one at the time, and I'm digging through and I'm trying to find where glucose. And we had this like bag of frosting in there, and we
Yeah.
had like these like glucose chunky tabs in there, and they looked kind of old and frankly kind of disgusting. And I felt kind of weird about opening like this old package of
Yeah.
frosting and squirting it in her mouth. But anyway, we used it, and it ended up working out fine. So I think
Good.
diabetic emergencies are probably more common in dental
Sure.
offices than others, and they're fairly manageable. And
Mhm.
long story short, we kept her at the office for a couple hours just to monitor her, and she did just fine. And her blood sugar came up, and of course she was
Good.
profusely apologizing for her behavior. And so
Yeah.
that's one of them. Yeah. So
Yeah. Well, I'm glad that it had a obviously really good outcome. And like you
yeah,
said, it's tricky because especially, with the way some people are with filling out their health history, some people aren't always the best about that. And
exactly.
so if they leave something out, you just got to be prepared all the time. It's always good.
Absolutely.
And just like I tell people from the compliance side, operate your practice on a daily basis as if an OSHA investigator is going to walk in the door anytime. Same rule
Absolutely.
should apply with emergency preparedness, right? Assume, and this might sound bad, but you know what I mean, assume that every
Hmm.
patient who comes in could potentially have an emergency. And when you make that assumption, you operate that way, and you have a great kit like this that can help you through those emergencies. I think that's fantastic. So
Yeah,
awesome. Well, we're
absolutely.
going to take just a very quick little break here. We'll be back in just a moment
Okay.
to continue our interview with Amie Granger.
Awesome. Thank you.
Elevate Compliance is a proud sponsor of Dental Nachos. Follow us on Instagram, Facebook, and LinkedIn, or visit our website at elevatecompliance.net. For questions about how the Elevate Compliance platform can help your practice, send us an email at info@elevatecompliance.net. Welcome back, Amie. Thanks for being here with me.
Thanks.
And
Yeah.
everyone
Thank
here, I
you for
have
having me.
Amie. Yeah, of course. Yeah, I have Amie Granger from POM Medical. So obviously, Amie, we've talked a little bit about POM and your great kits and what they're doing, and it's just fantastic. I love the product. I love what you have. I love the auto replenish and the scan the code. If there's just a particular one that you need replaced, I think that's all fantastic. But let's talk a little bit about Amie outside of the dental industry, because it sounds like from being a hygienist and from running this business, the dental industry occupies a lot of your world and time. It sounds like so. What are some
Absolutely.
things that you like to do outside of the industry on your days off when you do have those moments where you can relax?
Oh my goodness, there's so many things I love to do. I have coals in many fires, if you will. So
Okay, awesome.
um I I enjoy being outside much more than being inside, believe it or not. If we could do dentistry outdoors, I would be all game. Um, I love the gardening. I dig in the dirt. So I say when I'm not digging in gingival sulcuses, I'm digging in the dirt.
There you
So
go.
that's kind of my thing. So whether it's landscaping or planting flowers or attempting vegetables, um, it's uh, it's fun. So that's kind of what I enjoy doing: hiking, biking, skiing, all of that. Just bringing my kids and letting them explore the outdoors is one of my funnest things. So
Yeah, and
um,
and and how many kids do you have?
we have 4 children.
Four of them.
So
Awesome.
4 children under the age of 11. So we are
Wow.
busy at home.
Yeah.
So have an amazing husband who, he's yeah, it works out well.
Awesome. Awesome. And what does your husband do?
He is a financial advisor.
Okay. Awesome.
So yeah, he does investment advising. So he's actually kind of who also helped spearhead this process of starting a company. He's always
Good.
been the entrepreneur. Let's do this, like thinking about this, and he's always bringing wonderful ideas to the table. And so he's been very supportive in helping launch this company. He's staying kind of in the background because uh, yeah, he's just my support, if you
Yeah.
will.
Yeah.
Mhm.
That's great. I'm in the same boat with my wife. I would not
Yeah.
be able to be starting this business and getting this podcast and all these crazy things going if it wasn't for her
Oh,
support.
absolutely,
So yeah, completely understand what you mean. It is a lot to try and branch out on your own and start your own business. And so that's
absolutely.
awesome. That's fantastic. And I understand because we talked a little bit about this before our interview, but I have to geek out a little bit with you about it. I understand you're a big coffee fan.
Oh, my stars. Yes.
Okay,
Yes.
what's your favorite? Do you have a particular favorite kind of roast? How do you take your coffee? Are you an espresso? Like what's your favorite?
Americano all the way. It's
Okay, okay.
just, yes. So There's a wonderful coffee place around where I live that does its own roasting. It's called Pole Coffee,
Okay.
and they roast their own beans in a fire roasted coffee roaster. Oh my goodness, it is amazing. It's like this old fashioned coffee
Awesome.
roaster. I know if you're ever in the area, check it out. It's Yeah, it's delicious. So you get beans from there, and then I just have an espresso machine. I make myself my espressos every morning. No cream, no sugar, just straight black, just all that acid right on my teeth first thing in the
There you
morning.
go. That's right.
Do as I say, not as I do.
Yeah. Yeah. I think that's when it comes to coffee and sweets, that sentence, do as I say, not as I do, can be applicable in a lot of ways when it comes to the dental industry. Yes. I think
Absolutely.
I've seen more sweets sometimes in the break room in a dental office than you see sometimes, at the checkout line in the grocery store. So yeah,
Amen.
that's the way. Yeah,
Absolutely.
exactly. Well, yeah, I'm a big coffee guy. I've got mine right here.
I love it.
Yeah, and I just
Ditto.
like it. I just like it black. I love coffee. And my brother actually lives in Boise, Idaho, and he
Yeah.
is a manager for a big roaster there. And
Awesome.
so yeah, so I'm always like, hey, if you have samples or stuff that promotional,
Absolutely.
send them my way. So
Exactly.
that is awesome. So
Yeah.
how do you do it? How do you juggle, having four kids under the age of 11 and starting this business? And I know, like you said, you got the support from your husband, which is amazing, which is fantastic. But what advice would you give if there was someone out there, maybe a hygienist who was thinking about starting her own business or his own business? And what would be your advice? How do you juggle all of this?
Yeah. So I say work smarter, not harder necessarily. So you need to find the right people to get into your court.
Oh yeah,
So hiring things out, it's hard at the beginning, especially when you don't have the funds to do so. But finding people that can help you in certain areas and not be afraid to say, I don't know what I'm doing with this. I
yeah,
don't know, and not just knowing that you don't know everything about your industry, and finding people that can help you along the way, and finding great people like yourself to collaborate with and
yeah,
to talk to and help promote each other, and always be uplifting to other entrepreneurs, because I
absolutely.
think that's the biggest thing is we can get on this high pedestal like, oh, I'm so great, I do all these things, but really we're all in this together, and we're all I just think that finding a good support team, just in the
Oh, yeah.
industry and outside of the industry as well. So
Yeah, I love that. I love that answer because I'm in the exact same boat. Like I said, with my young
yeah,
business and getting the podcast started and stuff, man, I have such a great team around me. My wife even says sometimes, she's like, man, you have a lot of good people around you that are helping you. And I said, yeah,
yeah,
it's the same thing. Like you said, don't be afraid to ask questions and admit, you know what, I have no idea how to handle this. I don't even know what I don't know about this. So educate me and help me out. And that's amazing. I love that. That's such a great answer.
yeah.
So
And I think it was hard for me at the beginning because I was like intimidated. I took Dr. Steve Beadnell's class down in Portland, Oregon, and
sure.
he's the emergency speaker. And I was like, okay, I'm going to go talk to him after this because I want to talk to him about my idea.
Yeah,
And there were so many people around him. I was like, oh, he's just not going to want to talk to just a little hygienist that doesn't have expertise in the field
yeah,
necessarily. And I found him walking around the convention. I was like, hey, Dr. Beadnell. And I introduced myself, and I was so excited because he was interested in my product. I was like, this is so great. We set
yeah.
up a meeting. We had like a 2-hour phone call, and then it just kind of went from there. And it was
That's
very
awesome.
intimidating to begin with. So I'd say just don't be afraid to reach out to people, even if they seem like way above your
Yeah.
wheelhouse.
Well, because what's the worst they can say?
Yeah,
Yeah.
exactly. Yeah,
Right. Knows the worst thing they can say. It's always going to be a no if you don't ask. So
exactly.
yeah,
Yeah.
awesome. Love it. Awesome. All right. Well, we're going to take one last little brief break here. We'll be back in just a moment to continue our interview with Amie Granger.
So thank you.
The Elevate Compliance podcast is brought to you by POM Medical Emergency Medication Kits. Get your kit today at pomnw.com. That's POMNW.com. The POM emergency medication kits for dental practices are tailored specifically to the types of emergencies you're likely to encounter with a patient in your dental chair. They come with these really amazing little cards that explain how the medications work, and combine that with your basic life support or ACLS training, and you'll be all set in the event of a patient medical emergency. All right, welcome back, Amie.
Thank you
Yeah, thanks
for having
again.
me.
This has been such a blast today talking with you about everything with your family and with POM, and I'm so excited for the word to get out and people start finding a better solution for their emergency kits in the office. It's just going to be fantastic. We
Yeah.
talked about family, we talked about coffee, obviously some of the things that we both love, but we can't wrap up this interview without having at least a little bit of compliance talk. Hence, we are. Oops, this side now. Had Elevate Compliance. Yes, gotta
Absolutely.
talk a little bit about it. But
Absolutely.
you mentioned a minute. You mentioned a little while ago that compliance is something that is important to you, especially when it comes to adhering to the rules that can save a patient's life. Right. Obviously, that's a big
Mhm.
one. Um,
Absolutely.
what is your biggest concern in the dental industry, sort of abroad, about compliance? So don't think about like your practice specifically, but
Mhm.
what's something that you know is a concern you've heard from other people in the industry, and you know that's something that we could tackle? Like, what's one of your biggest concerns about compliance in the industry abroad?
Yeah, in the industry abroad, I feel like people's medical kits, of course, they're not stocked properly. They don't even have the right medications, but more importantly, people don't know how to use the medication.
Mhm.
I think that's the biggest thing. I mean, talking with colleagues and different professionals in the field, they're the same thing. Like, yeah, in the state of an emergency, they don't remember how to use the medications. And so and then if you go to find your medical kit, if you can find it underneath the paper towels under the sink in the lab, it's a Tupperware container full of expired medication.
Yeah.
And what's going to happen when you have a medical emergency and you administer expired nitroglycerin, you know, in the patient? If they don't survive, what's going to happen?
Yeah.
You know, you're going to be liable for that death, or,
Could be
or
potentially. Yeah. There's a
potentially held
possibility,
liable.
right? Yeah. Yeah.
Yeah. So it's like, just cover your bases, be prepared, be ready. And I think that that's just kind of a passion of mine for sure.
Yeah. So without getting you in trouble with your team at the office where you work, or anybody else who knows you in the industry, uh, I'll ask a question that might be tough to answer with, again, without making people go, Amie, why did you answer that way?
I know.
What would be your advocacy in terms of like, or would you advocate for maybe everybody in the industry having to take a more stringent course, like an ACLS type course as opposed to BLS? Or if that's not a route that you would advocate for, what do you think would really make a CPR or basic life support training more impactful to help with that? Because like I said, I used to do basic life support training, and
Yeah.
I'll be honest with you, going through emergency med kits was not part of our curriculum.
Yeah.
And sometimes people would ask questions, and we were well enough trained in it that we could kind of walk you through it, but it wasn't, again, like an EpiPen versus injectable, that is not something I would have been able to educate people on. So just out of curiosity, like, what are some of the things in a CPR training that you would find that would be more impactful there? Or would you advocate for more, serious education on these subjects?
Yeah, I 100% think that there needs to be more education and more practice. I think we maybe at like a safety meeting, one of your monthly safety meetings, grab your actual kit, whether it's POMS or one of your kits you have in your office, and bring it out and have everybody look through it,
Mhm.
talk about it. I think that Dr. Mark Donaldson, he at one of his conventions said it really well. Like, if you want to practice drawing up medications, go to your local hospital and see if they have any expired vials of medications that you guys can
Yeah.
practice at your safety meetings drawing up. Obviously, don't inject each other with them,
Right.
but uh, but yeah, you can practice drawing it up. Practice the dosages. And let me be clear, I have different levels of kits if people want, draw up epi or injectable epi or that kind of thing.
Okay.
So it's not all draw up medications, but it
Yeah.
just depends on their price point, how they want to go about it. But yeah, I absolutely think at a safety meeting to have it out and to educate or educate the staff on how to use it, because what's going to happen is that maybe the doctor's excellent, right? He's excellent at handling medical emergencies, but what if he's the patient? What
Yeah.
if he begins to have a stroke? Like, what are we going to do? We want to make sure we can save his life, because that would be bad.
Absolutely. Yeah. I think I saw a statistic once somewhere that the person most likely to have a heart attack in a dental practice is the dentist.
Absolutely.
I want to be clear for anybody listening. Don't quote me on that. I don't actually know if that's a legitimate statistic, but it wouldn't terribly shock me if it
No,
was. So
no, and they're generally the oldest person in the practice when, as far as even the staff goes. So
yeah,
not always, but generally.
yeah, yeah, awesome. And so one more time, just give, before we get kind of ready to wrap up, give one more kind of overview of the product, one more kind of run through about how POM can mitigate a negative patient outcome during a medical emergency.
Yeah. So when you have a POM kit, it'll kind of deliver the peace of mind during that medical emergency. So you have a medical emergency happen in your chair, your adrenaline spikes, And you grab the kit, you open it up, it'll say common medical emergencies. You'd be like, okay, this patient's having chest pain. This is how I am going to do this. You pull out the nitro, you pull out the card, you read it exactly. Did the patient take any erectile dysfunction medications in the last 24 hours? That is a huge contraindication. You could make the patient significantly more ill if you do administer medication like nitro, if they have taken one of those drugs. So where you might not have thought of that in the
Yeah.
case of an emergency when you didn't have the cue cards. And so then you look through that, read the dosages, administer the medications. There's all sorts of different factors that go into play with each medication, and we have them all written out on those cue cards. So they're very, very easy to follow. And then you put your medications back in the cupboard and you don't have to think about it, right? You're not going to be like chasing the doctor to order more epi. It's going to
Yeah.
expire in a month. Order this, order that.
Just scan the code and get the replacement.
Scan the
that you need
code and
for-
I'll be
Yeah.
there. And also, I'm very happy to provide resources to dental offices for training resources, or even like refer to you for all of the compliance stuff. If there's questions, I have people in my court that I can refer people to. I can't do it all myself, but
Yep.
I would, I think that just like a full team collaboration, and I will absolutely take time to talk to people, help them decide what kind of kit they want. Yeah,
That's awesome.
it's a great product.
That's awesome. Love it. Love to hear it. And so before we wrap up, how can people learn more about the product? What's the website to go to order? Talk a little bit about how we can find our POM kit for our office.
Yeah, so if you go to our website, www.pomnw.com, that is going to get you to our website. You can look through. There is 2 kits already on the website that you can order. We're doing a significant sale as we launch. So,
Awesome.
which might be kind of a crazy business decision, but we are
Get the word out fast.
getting the word out that we want to get these as many hands as possible.
Yeah.
We're currently licensed in Washington and Pennsylvania. We're actively working on many more states, including like Oregon and Idaho. It just, as the demand needs, of course, we have to have a pharmaceutical wholesaler license, so it becomes a big process. So yeah, go to the website, find a kit. If you don't see a kit on there that you like, if you'd rather have nitro spray versus the nitro tabs, just shoot me an email. I can set up a time to call you and we can create the kit that you want at a price that's reasonable for you. So
I love it. Customizing the kit. That is awesome. Out of curiosity, why Pennsylvania and Washington? What's the connection?
That is a great question. So I have a wonderful business partner. Her name is Melissa. She's a registered nurse, and she is taking care of all like the licensing processes as well. And when we've been just applying, and those were the first, or we've had Washington first, and then Pennsylvania came back and approved right off the bat. So
awesome.
It is, yeah. So there's no real personal connection there, but it is where we are licensed. So we may as well utilize it.
Well, we are Elevate Compliance. We are proud sponsors of Dental Nachos, if you're familiar with Dental Nachos.
Okay.
And, they're based in Philadelphia.
Cool.
And so when you said that, we're going to Elevate will be at their Super Dentist Boost Camp coming up in August in Philly. So when you said that, I was like, I wonder if there's any connection there. So,
no, that's awesome.
Well, great. Well, I'll have to get some handouts for you that I can take with me, to give out while I'm out there, since you're already can send kits that way. Well, wonderful. Well, Amie, I really appreciate your time. Thank you so much for being
William.
On the podcast. Yeah. And it's just Will.
Okay. Well, sorry.
No problem. Awesome. Well, yeah, thanks again for your time, and I'll talk to you soon.
Awesome. Thank you so much.
Thanks, Amie.
Yep. Thank you.
The Elevate Compliance platform is your practice's one-stop shop for compliance. Train your team anytime, anywhere, and update your written OSHA, HIPAA, and infection control programs anytime with just a few clicks. No more boring training, no more oversized manuals taking up space and collecting dust. The Elevate Compliance platform is accessible 24/7, 365 from anywhere on any device. Train and onboard new hires, receive continuing education certificates, and update your practice manuals with ease. Elevate Compliance. Let's elevate your practice's compliance together. Welcome back to the podcast. That was great, Amie. Thank you so much. I really appreciate you. I really appreciate your time and coming onto the podcast with us. And before we get ready to wrap this up for the day, again, I just wanted to say thanks to everybody who's listening in to our first inaugural episode of the Elevate Compliance podcast. Check out elevatecompliance.net to learn more about how the Elevate Compliance platform can help you. And if you have questions, comments, or concerns about the platform, you're interested in learning more about how Elevate can work within your practice, don't hesitate to send an email to info@elevatecompliance.net, and I will answer those personally. So once again, thanks for tuning in to our inaugural episode of the Elevate Compliance podcast. We'll catch you next time.